What happens when emergency room workers are asked about chiropractors? Thousands of doctors, nurses, physical therapists, and other medical professionals shared stories, and many of them were deeply unsettling. One of the most common themes was neck manipulation. Multiple ER nurses, stroke specialists, anesthesiologists, MRI technicians, and vascular surgeons described patients arriving shortly after chiropractic neck adjustments with vertebral artery dissections, a tear in an artery that can lead to a stroke. Some patients recovered. Others were left with permanent disabilities. And some didn't survive. One emergency nurse recalled a woman in her 30s who developed sudden dizziness after a neck adjustment. She was rushed to another hospital because both vertebral arteries had been damaged. Another healthcare worker remembered a healthy young mother who suffered a fatal stroke after a chiropractic visit. The stories weren't limited to adults. One orthopedic worker described a 16-month-old toddler whose parents took him to a chiropractor after he developed a limp. The chiropractor claimed to have put the ankle back in place. The child actually had a fractured ankle. Several pediatric healthcare professionals also expressed concern about newborns being taken for chiropractic adjustments to treat issues like reflux or difficulty breastfeeding, saying these babies often needed proper medical evaluation instead. Physical therapists shared a different frustration. Many said they regularly treated patients who had spent years getting weekly chiropractic adjustments. When asked why they kept going if it worked, the answer was often the same. The pain always came back. In contrast, physical therapy often focused on identifying the underlying problem and teaching exercises that patients could continue on their own. Not every story involved a catastrophic injury. Some involved delayed diagnoses. One patient had severe back pain that was actually a kidney infection. Another had spinal fractures that went unnoticed. Others had serious cancers that were treated with adjustments instead of being referred for appropriate medical care. To be fair, not every chiropractor was described negatively. A few commenters shared stories of chiropractors recognizing something serious, refusing treatment and sending patients to medical specialists. Those stories were far less common in this discussion, but they did exist. The biggest takeaway from healthcare workers was consistent. If you have persistent neck pain, back pain, numbness, weakness, dizziness, or symptoms after an injury, get evaluated by a licensed medical professional. For many conditions, evidence-based treatments like physical therapy, exercise, medication, or specialist care are generally recommended over high-velocity neck manipulation. Your spine and your brain are worth protecting.